Thank you, Monica, for introducing me. I'm going to talk today about our Narcolepsy UK Charter. Quick slide here on disclosure, which I won't worry about too much here because we're all more patients than anything else. So let's turn this one on. Right. So before I talk about the charter, just a little bit of scene setting about Narcolepsy UK and what we do, which is quite important because it leads into why we actually chose to go down the route that we did. We're a very small organisation, 40 years old last December, and we're smaller than we have been ever, I think, in terms of actual paid staff, all of whom are part-time. Part of that has been to do with austerity post 2008, and the fact that lots of our funding areas, family trusts, private trusts, have actually been spent out since 2008, since the financial crash, and also the last couple of years have been exceptionally hard for everyone, I think. So we've slimmed down, but we're actually doing more for more people. So we have 6 trustees like me who are all volunteers. The trustees are also directors of the company. It's a company limited by guarantee because it's very difficult to ask people to be a trustee of a charity in the UK without having the protection of a company limited by guarantee. And a lot of what we do is very similar to everybody else. So this morning, myself and another one of my trustees spent an hour and a bit with a team from a well-known pharma company, I'm not going to name them, who we were working with this morning to try and raise their awareness of the condition and talk about, again, the charter, the market, just to really get them introduced to the whole world of narcolepsy in the UK, because it is different in just about every country I've come across, and I've been to a few. So that was kind of upskilling, I call it, to get them into the market. I don't need to tell them their job because they're all great professional people. It's not really raising awareness. I mean, I'm a great, I suppose, believer in doing things for a reason. Raising awareness is great, but if all you're doing is actually raising awareness, then I don't know whether that actually contributes to much in the end. And, you know, we can all agree to disagree about that if you want to. We support people with narcolepsy, their family, their carers, just as important, even more important, I think sometimes, is to try and assure some of the people that live with us that we are not the only, you know, they're not on their own, that they also have other people like them around them. And when we organise our annual conferences, we try and bring families together as well, so especially siblings of kids with narcolepsy, partners of people with narcolepsy. So the last conference we had was in September 2019. Bit of a shame. Hopefully we'll get to do one soon, but you know what it's like. You've got as much COVID in the States as we have over here. One of the most important things we do is the benefits work. We help people access medicine, access social security benefits, and that is really where the charter comes into its own. So I'm going to jump into that because it was there to tackle some of the challenges and some of the discrimination that we face, and I think, you know, that's pretty much consistent across the world. I've seen it in Europe. I mean, I see some of the sites that you guys are part of, and know probably some of you on here well enough to know that you actually face the same challenges that we do, albeit in a slightly different way. So the charter's been a bit of a slow boil. 2017, we kind of had the original concept, and part of this was to get us around the issue that we faced when we were trying to access funding and medicine. So from a funding perspective, it was how do you tell a story with a big enough vision that can hook people in? So hence the conversation I was having this morning, or the talk I'm doing now. And then the flip side of that was how you can actually persuade people that the story that you're telling them is actually real. So it's all very well me sitting here today and talking to you about how I feel about narcolepsy, but when you compound that and you tell over 300 people's stories and 150 of the people that live with them's stories, then that's very, very powerful indeed. So that's kind of what we've done with the charter. So we presented it back to, we asked people to get involved, and they did. We played it back to them. We took it to even the Royal Society of Medicine and presented it there as part of a program that I was lucky enough to squeeze us into. And then we presented it finally in 2019, so the last conference that we have, and it's been going since then. I don't think any of you would be surprised in what's in here. It should speak for itself and talk about, you know, exactly what we all experience and feel. And in that way, it is kind of international. Some of the things in there are a little bit skewed towards the UK, but that's some of the questions that we asked. So, and it's a statement of our rights. So, you know, it's universal in that way. So the first point was that we all have a right to live in a society that understands and recognizes the impact of narcolepsy on themselves, their families and carers. You know, and that's a great one. I often blame you know, Walt Disney for a lot of the issues that we face, only really because he's probably made as many films about sleep as anybody else, and they're all slightly skewed. So, you know, sleepy, you're lazy, or feckless, or whatever the right words are. So I don't necessarily subscribe to the view that narcolepsy itself is something that's stigmatized, because I don't think people know enough about narcolepsy to be able to stigmatize it. But what I do believe is that people stigmatize sleep, and they stigmatize you because you are sleepy, and people associate lots of horrible things with being sleepy, like being lazy, and we're not lazy. We have some real issues to deal with. So people with narcolepsy have a right to an early diagnosis and information, you know, and this is key, because when you see people who are facing, you know, anywhere down, let's say from a decade to, I think we've got some figures back that suggest that it might be about 6 years in the UK now, and that's probably skewed because the position is slightly better for children than it used to be, I think. You know, we have a right to an early diagnosis and information. The key thing here is that when you're on that journey, let's call it that, from just developing the disease to being diagnosed, that's the period when you're most at risk. Well, and also when you're in your early days of being treated, I think. But, you know, let's just say when you're struggling to stay awake, then if you're studying, or you're working, or you're just from a family life or a social life, or your work, it's so difficult to be able to face even the most basic challenges, and knowing that there's something potentially wrong with you that can, you know, to varying degrees be treated is absolutely fantastic. And you need to have access to that early diagnosis and information so you can start to manage your life, and people can help you. So that leads us into, you know, this is the reason why I would, you know, I'm willing to work with any pharma organization who contacts us, because my only interest is in providing, you know, the best quality care for people and the best treatments that we possibly can, and it takes far too long to get to market anyway. So it makes much more sense to try and shave, you know, if we can shave a year off, 2 years off by working with people, then that's absolutely what we should be doing. And not just me, everyone should be doing it, I think. We have a right to an education, tremendously important. Again, you know, I know adults now, because I've been doing this for long enough, I know adults now who have managed by seeking and fulfilling, their rights to an education and their rights to an education at school and at university, who now hold down some great jobs. And I also know other people who have had narcolepsy for a lot longer who never had that opportunity. And education is, as far as I'm concerned, a right, and it shouldn't be something that you cannot have access to just because your illness prevents you or you don't have access to medicine. And that leads you then into employment, because this is a very important tenet as well. When you have an education, you can seek work. When you have an education and you can drive, let's say, you can drive to seek work. When you're competent in your medicinal regime or your lifestyle, or both, you're able then to drive or take public transport to a place of work and be there at a particular time and do well and succeed and have that career progression. So these are all important. And the last one is, quality of life. It's not all about just scraping by. And I hope that resonates with some of you. It's not just about, I had a great day today because I managed to stay awake between these particular hours and I did some fairly basic things and that was it. That's all you've done. We have a right to a quality of life that says, actually, you know what? There is no reason why somebody who has narcolepsy cannot go to the cinema. There's no reason why we can't sit in a room in the dark and not fall asleep. No, or even if we fall asleep, we can fall asleep because we've got narcolepsy. If we miss a bit of the film, we miss a bit of the film. But we have a right to actually maximize that quality of life. And the people that we live with have a right for us to be able to have that and exercise that right. So let's have a look at what we did then. So we went to an external agency because we didn't want to play back a kind of a survey monkey survey or something that we touched too much with our own hands. So we went to an external agency, said, this is what we want to do. We want to understand just how much this narcolepsy thing touches our lives and whether or not we can do that in a way which is great for people with narcolepsy to do. So we had things like a survey that would actually keep on going if you fell asleep, which we thought was quite important because I know what I can be like, and I think I'd probably just proved that earlier on. If we had something that could capture as much data as possible, so when we get tired and sleepy and we have a particular point we want to make, we just keep on typing maybe. So let's have fields that capture all this information. So we have a massive amount of information that we've captured in a format that is totally depersonalized and was done to an externally validated market research standard. So it's a great piece of work that has given us an awful lot of data. So if we look at this, and I actually have it I even have it on the wall behind me as a reminder, the numbers in here are fairly shocking. And they're not shocking to me because they're not what I expected, but they're shocking because if this is what we accept as normal, that narcolepsy impacts us in this way, then really, I may as well not be doing this. And for other charities around the world and the Wake Up Narcolepsy organization, then this is what we have to deal with, and these are the kind of things that we need to remove. So we have a disease that affects your mental health and well-being, to the tune that 84% of people are saying, yeah, it affects my mental health, and 88% of people say it affects what I can do, and 65% of us are saying the relationship affects the relationship I have with my partner and the way I build relationships. Then that's not normal, and that's not acceptable. So it doesn't show us anything that we weren't expecting. But when you look at those key areas of people's lives. You know, if you start your life like this, or when you're a child, when you're a teenager, or even for me, I was diagnosed at 43. So, you know, as an adult, this is not good stuff. You know, this is fairly destructive, without throwing anything else into the mix. So these are some actual comments that came from the charter, and these probably resonate with you. I'm not going to read them because you're going to have access to the charter after this, and hopefully that will be you can read more to your own extent. But, you know, mental health, depression, friendships. You know, I used to go out, but I don't go out anymore. You know, I'm bright, I'm not stupid. You know, I often say to people, and again, you know, if you've met me, you know I can be quite stupid, you know, and like everyone else, when I slow down, or I can come across as stupid, I can get slow. When I'm tired, I get much slower. But I'm no more stupid than I was before I had narcolepsy. It's just there are times when I cannot do things, and that's it. It's not that I'm stupid. It's just that sometimes I can't do things. I can't perform on demand. I'm not a performing dog or a monkey. I'm good when I'm good, and when I'm bad, I'm quite bad. And the bottom one, you know, I've showed this. I took this to World Sleep in Vancouver in 2019, and I remember someone coming past the stand I had, and they picked up a physical copy of this, and they laughed when they pointed to, I think it was this one at the bottom. It says, my partner gets annoyed when I forget my meds and I get too drowsy. He thinks I'm ignoring him, but I can't physically focus on things all the time. Because it's true, you know, of course it's true, because it was written by a person, and this is kind of the whole point. Everything in here should resonate with you, with the people around you, and if it doesn't, maybe they don't really understand, but perhaps if you show them this, they will understand. So that's our aim. So feel free to share the copy that you get after this. Here, diagnosis. So you see this has gone down here on the bottom to kind of circa 6 years. I think that is because in the UK we dealt with the swine flu vaccine pandemics and the impact that had on childhood narcolepsy in general. So I think maybe that figure might be slightly skewed, so it's less than it really is, but I'm not sure, and we still need to look at that to work out whether that's the case. But even so, 6 years, you know, is ridiculous amount of time to get diagnosed for something that's frankly, you know, it's a people breaker, because we all know that sleep is the one thing that if you withdraw that, then people start to crumble. It's a classic torture technique, depriving people of sleep. So this isn't a good place to be, and to have a third of people saying, you know, they weren't taken seriously to begin with, or that they weren't diagnosed in a reasonable amount of time, isn't something that we should feel comfortable with. And maybe that's because there's not enough decent sleep clinicians out there. Maybe it's because often people see the wrong kind of clinician, and maybe we should have more access to neurologists rather than more access to sleep medicine, which is, you know, in this country, a lot of our sleep centres are more respiratory than anything else. So this is not good. It's a long way to go. And, you know, remember again, while we're doing this, we are suffering because we don't have access to medication, or the right medication, and we're trying to work, and we're trying to get on with our family as well. Education, this again shows a slightly skewed picture here, because in the UK it's actually mandatory now. It's against the law-ish not to be in education if you're under 18. So that's why we have a massive 99% of people under 18 in education. To varying degrees, that can either be full-time, or for some people it could be a part-time apprenticeship or something like that. But when you then look and see that, you know, only 14% over 18 are in education, that's not because all of a sudden we've sent everyone off to university. That's because there are a lot of people still who don't have access to work, because they may not have the qualifications. They may still be dealing with their illness, depending on when they got it, or they are just not capable of working, or they may face some kind of, the classic struggle between, if you're young, if you're 18 and you want to, but your parents are maybe being, cautiously, I call it, I'm a parent, so I know how this works, because it works both ways, cautiously overprotective. Right? So they've got their arms around their child because they've got narcolepsy, and maybe they don't get the same push that other people get. We're all a bit guilty of that. So let's have a look at the next one. So where we can all help, I guess, is being able to describe the condition and get the support we need. So these figures, again, speak for themselves. Awful lot of people just need help, massive amount of children, 64% of people needing help to describe their condition to their educators, to their school, to their teachers. I often think that actually for a group of people who actually want to work with children and are clearly interested in education, teachers are sometimes the hardest group, or if not teachers, the school board or whoever's running the school. When you have different in school, it's hard. It's hard to manage that through, because although we have a state education system, we also have private schools. We have some schools that are neither really private or state, which is a bit confusing, and I won't go into that, but they're hard places to break into and explain that there's a need that somehow they're not addressing, because people in education sometimes, in my experience, take that as a direct challenge, and it's not meant as a direct challenge. It's meant to help the child. It's not about the school, it's about the child. So unfortunately, that transfers into employers as well, but slightly less, 54%. That does differ. One of the worst employers, I'm afraid to say, in this country are our National Health Service or services. They can be some of the least understanding people that I've come across, and I'm quite happy to say that, because I could back that up. As are our social security staff, who are largely outsourced and measured by targets. Narcolepsy is not significantly understood. Again, I think that comes back to sleep. It's very hard to tell people you've got a sleep problem when you're talking about a basic function that everybody does. Everybody sleeps. Everybody has a view on it. It's a bit like going out in the rain. Everyone's going to have a view on how wet you're going to get, because they've all got experience of it, but they all view rain and how much of it is enough to get them wet, or define wet. It's difficult. It's difficult because everyone has an experience of it. So we try and break down some of those barriers, and we do kind of get involved, and we're quite active in our interventions. I mean, I do call it active intervention. It's positive intervention. So if you ask us to help, you come to us, you ask to help in these areas, we will of course help. Challenging, but we will help. And an interesting fact here is that I got my narcolepsy at 43, as I've said, but adult men do find it much harder than some other places, and we have some ethnic groups as well that we don't see the same level of representation on, and that's probably our fault for not really pushing that. And I don't understand some of the reasons. I don't think it's down to the fact that people don't get narcolepsy. I think it's a different way of looking with it, and we just don't have some of that information that I wish we could have. And I wish sometimes I could get my arms around men like me. That's going to sound strange when it's played out the other end, isn't it? But what I mean is, I wish it was easier for men of a certain age to just come forward and admit that they've actually got a problem and that they need help, because they find that their story is probably exactly the same as mine. Okay, so what does this help? Well, this helps being able to articulate what you need, and I think some of these things would probably be the same for you. I don't know, but we focus on some of these. We want speedy access once we've got approval for new drugs, realistic pricing. I know it's different in the States, with your medical insurance and everything else, but the orphan status for new drugs is a double-edged sword for us. It's great that it encourages people to come in and create these new drugs. It's not so good when they come with pricing that is almost preventative and doesn't allow, say, a nationalized health service to feel that they can provide it, and that's the kind of daily challenge that we face here. So we also want decent percentage success rates. Some drugs are viewed as a kind of panacea, as a wonder drug, and the amount of times I have to write this X is not a wonder drug. You have to persevere, you have to try it in combination and everything else, and combinations are a big problem. There's very little research done on the classic combinations of drugs that we take, or even some of the drugs that we take that aren't licensed for narcolepsy. So I take a combination of drugs, none of which is actually licensed in the UK for narcolepsy, but they work, so I take them. Some of them are harder to travel with. Having drugs that are easy to move, in country, out of country, on planes, with more or less paperwork would be great. And also, things that help us to do these basic things, to drive, been through this before, to study, to work, to play, and to keep up with other people without actually having to suffer for it. Patient voice, I'm a big fan of, I can use the charter now, we can use the charter, but it's mostly me that does this bit within the organization, to talk directly to people who are interested in providing us medicines. I don't like working with middle organizations. I don't like working with other people who seek to profit from us. I like working with people directly, and I like to build up a relationship with them so that I can trust them. A lot of people don't trust people in the pharma world. I trust anyone who wants to work with us, and I think that's the only way you can be, and that's the way that things should be. But trust is earned and it's not given, and that goes both way around, from my point of view, from their point of view. And really what I want to do is, my only interest in all of this, because I do everything I do for nothing, is to empower other people. So I want a patient in the UK to know, maybe not as much detail as I know, but I want them to know what I know, so that when they walk into their clinician, they can be quite demanding about the level of, one, knowledge and expertise they have, and also, two, the medications that are available to them. And that people don't see that as a threat when they're a clinician, and they realize just how much it can help them. And I work frequently with clinicians to access people medicine over here, and people might not know that's the case. So anyone who's not particularly confident as a clinician about flexing, I'll use the word muscles for the sake of it, but flexing their muscles within their own organization to access funding or new medication, I'm very happy if they come to me, and I will just help them quietly in the background, and be the grey man that nobody ever sees. It's not about me, it's about their patient. So was all of this worth it? Was the charter worth it? Yes, because we don't just walk the walk, we can evidence it. It's all very well, I could sit here for hours and talk to somebody about why it's really important, but that's just my worldview. When it's hundreds of people's worldview and the people that they live with, and it's being externally validated and accredited, it's a fantastically powerful piece of work. And helping pharma to understand what it is that we've done and what they're looking at has helped us now, because those people, and some of them I suspect are on this call watching, are now using the information that we've gathered to inform their requests to industry regulators and approvers of the need for new and innovative drugs. Okay, so in a way, everyone who answered our survey questions is helping us, helping themselves, to help others be able to access that market for them. And that's not about making people money. That's about access to medicine. That's all it is. I don't care whether someone makes money on it, frankly. I just want it now and faster and quicker. So what this is actually doing is this is winning us success and successes that weren't possible for us before. Because we all believe in it at Narcolepsy UK, and it is a great story. It's very, very engaging. I hope you enjoy it, and it's about me, you, all of us. Thank you.